Hey there, friends.
Good morning.
Good morning. I feel like I know you already, but well, we did speak once on the phone.
Yes, we did.
Yes, good. So nice to see you.
You too.
It's early out there in California.
It is. It's 8 a.m. So, yeah.
Well, you look beautiful. And I'm so excited to visit with you today and excited about all the information that we're going to share. So we have a lot to cover, but let's go ahead and start off. Introduce yourself a little bit, please, and tell us about you.
Yeah, so my name is Quozette Valera, and I go by Q, like the letter. And I am a pelvic floor physical therapist out in Southern California. And I'm based in Los Angeles. I practice at a clinic called Women's Advantage, Men's Optimal Health. And I have additional training as a postpartum doula and childbirth educator through CAPA, so the Childbirth and Postpartum Professional Association. So I work full-time as a PT, and then I just recently started branching out into childbirth education.
Okay, good. So are you doing any doula work, like hands-on physically with them?
No current clients, but I did the training mostly to have that as an option for prenatal patients, right?
Yeah.
If they have their baby and they can't really come in immediately postpartum.
I love it.
You know, just bridging that gap.
Yeah, I love it. That's amazing. That's good. Okay, and let's just give a plug too for your program. You have a program, and we'll talk about it again at the end as well, but tell us a little bit about the program you just developed.
So I recently developed a childbirth or childbirth preparation class for pregnant or expecting couples or individuals. So what that is a 3-part series where we break down pregnancy changes, preparation for childbirth, and what to expect for postpartum recovery, and a little tiny bit on infant care. So the postpartum doula training came in handy for that. So just the basics, infant care, safety, soothing techniques, all of that. So
great.
I offer that locally, and the goal is to eventually reproduce it so that other pelvic floor PTs can offer it in their practices.
Excellent. Good. Okay. And so any goals to have something online, like virtual sessions or anything like that?
I'm hoping to. I actually have a friend who they develop online courses digitally. So they do that for pretty much corporate companies who want to digitize their HR training. So they were showing me a couple of their pieces of work, and I think it's possible. I think it's doable. So we're going to look into that.
Yeah, that's cool. There's so many options with technology now. It's exciting to see what everybody's coming up with. So I look forward to it.
Yeah.
Okay. All right. So we are talking today about childbirth preparation and recovery tips.
Yes.
So let's just jump right into it. What did you do in preparation for childbirth?
So I don't have any kids. So the reason why I bring up this question is because I think a lot of people are overwhelmed with the amount of information that already exists. So whether that's taking a class or reading a book or, you know, talking to friends and family, I think those are all great options. And no matter what somebody chooses to do, they have to find the right fit for them. So mostly looking at all your options and thinking, how do I learn? How do I receive information from this?
That's a very helpful tip, because some people learn better by reading. Some people learn better by watching or doing.
Yeah.
Good. Okay, so what was or is the most intimidating aspect of being pregnant?
So I've heard from most patients that they really have a fear almost of pushing. So for vaginal childbirth, the fear of, well, what's that going to do to my body? I already have back pain. I already have issues with my hip. How's that going to affect me? So there's a big fear about how is the pregnancy going to affect my body, and then how's that going to change right after I deliver the baby? So that's a huge fear that I have with patients.
And I think with increased awareness comes some of these increased fears too, because so, you know, back when I had my first baby, I had never even heard of the pelvic floor. So I wasn't worried about damaging my pelvic floor because I had never even heard of it.
Right.
So, and just to give a frame of reference, that was 1999. So I didn't have a cell phone. I didn't have internet. I mean, we've come a long ways in 20 years.
Right.
Okay. So what do you think is the most challenging aspect of pregnancy?
So for me, what I've seen the biggest challenge with is adapting to all the physical demands of pregnancy and trying to balance taking care of yourself, but also taking care of the situation. So trying to prepare for baby and trying to, you know, everybody's trying to get everything done in kind of like a timeline of that 10 months. We say pregnancy is 9 months, but it's really 10 because the average month is 4.5 weeks. So it comes out to about 10 months, and everybody's trying to cram all their, you know, their life events, and it's such it's a celebratory time. And then trying to balance that with taking care of yourself, because, you know, with the complicated pregnancies like gestational diabetes and preeclampsia and the higher risk ones, it's tough. It's tough to balance that. How much of yourself can you take care of? And people are still working throughout their whole pregnancy.
Yeah, and if you have other children too, and you have family and all these obligations, so balance. Good. Okay, and then the most challenging part of labor, birth?
So for sure, the pushing, I think, for a lot of women is what they think is going to be the most challenging part. But I've had patients say that the pushing was super fast, and they almost weren't ready for it, especially if it's the second or third child at that point. But what's actually a little bit more challenging is that transition between active labor, so first stage labor, and second. So second is when you push. So everybody thinks that that's the toughest part, and it really is. It's difficult. So I've heard. But it's that transition from active to pushing stage, because the active labor can last days. Yeah. So I think a lot of people don't understand that the pushing is a fraction of the whole process. So even though that's a physically demanding part, you might just be, by nature of exhaustion, just tired from the active labor, the hours spent in active labor. So that transition where your contractions intensify, I think that's a tough part for a lot of women. Yeah. And that's where a lot of them who want to go unmedicated ask for an epidural, is that kind of
yeah, exactly. So all three. I got to transition and I was good. I was breathing, and then I was like, no. Right. But also, during my labor, I was using a TENS unit. I was rocking. I was moving, and so then at that point, you get at that stage in life. Back then, we just got into the bed and I got on my back, and then the pain was like, no, okay, I can't do this. I'm sure that I could have, but I didn't want to do it anymore. And give me an epidural. No, there's nothing wrong. No, not at all.
More so just the expectation, I think, is what makes something difficult, right? Yeah. So people are like, oh, I'm really scared to push the baby out. And then they don't even realize that maybe even before you get to that point, you're going to be so exhausted that you won't care if you had an epidural.
Yeah. And I don't feel like, in terms of my own experience, I was ambivalent. Like, yeah, I'd like to try it. To me, it was more like a challenge. Like, hey, can I do it? Let's try it, because I have the TENS unit and I know, breathing things. But we really didn't explore any alternate delivery positions. So I think that's, if I had to do something differently, I would probably do that, explore some alternate positions. But I have no regrets. It was beautiful.
Can I ask if you did any birth classes, but when you had
I think with the first one. Okay, the only book I remember reading is What to Expect When You're Expecting. That's so, again, we didn't have internet. So I believe that with my first one, they had a childbirth class that I went to at the hospital. And so they did some breathing in that, and I think my husband and I went a time or two. Okay. But then with second or third, I was like, what are they going to teach me?
Yeah.
Not that I couldn't have learned anything. I'm sure that I could still learn things, Yeah. But I didn't have and I talk with my hands a lot too. You might not be able to see them all. But then I had a toddler too. So then you're just balancing. Well, when are you going to go, and what's going to happen to this child when we're at the class? So I think you brought up a really important point though about fatigue, because, okay, so you're tired from that first stage, but also you're probably tired just entering that first stage. You haven't been sleeping well, you're uncomfortable. And even though you're fatigued at the end of the day and you really just want to sleep, sometimes sleep is evasive. So
fall asleep between contractions.
Yes, some people can sleep easily in different places, and some people have a harder time to sleep. So good information. Okay, so what about postpartum recovery, the most challenging piece?
I mean, you could probably attest to this too. I think it's still the balance. I think it's always going to be the battle of, do I take care of myself And, if I want to, or even if I should, and I know I should, how can I fit that into my function now, my role when I'm responsible for another?
Yes. So, I think that was one of the scariest things, was like, they're so protected in your belly, they're safe. And then they're out in the world and you're like, oh my goodness. Oh, such the responsibility.
Right. And I think regarding, as a pelvic PT, I don't want to say it doesn't matter, because there's definitely some conditions that are a lot more severe and a lot more difficult to manage. But whether it's leakage or prolapse or just abdominal wall weakness or the diastasis, it's almost just like the severity isn't correlated to the struggle. The struggle is always related to, well, is the baby getting enough sleep, and is the mom getting enough sleep? And does the mom have adequate support? So even if she wants to go to therapy, can somebody watch your baby, or can she bring the baby?
Yeah,
is
exactly.
the clinic set up where she could bring the baby? And even if she brings the baby, will the baby, relax for an hour? Or where's the baby going to be on the schedule? Right. Does the baby even have a schedule at this point? Right?
Mm-hmm. That's huge. I think also a piece that we really have an advantage now with is awareness. So that's something that I really wish that I would have understood how my body worked better going into postpartum. So, educating in advance is huge. And now with internet and social media, we have so many opportunities to connect with people. So they're entering postpartum, hopefully more empowered and more informed and not as scared. I don't know.
Right. Yeah. That's a really good point. That's the whole reason I even went into childbirth education, because I got kind of frustrated. I mean, with marketing for a private practice, we tend to go to the physicians. We tend to tell the
the referral sources.
Right. And so now that we have direct access in all states, regardless of insurance, that's a whole different story.
Yeah, exactly.
Because we do accept insurance, so there's that. Too. But it's hard. It's hard to convince somebody who is seeing however many patients a day and who is focused on, shifting back and forth between delivering and surgeries and follow-ups and all of that, to say, oh, here's a referral pad for physical therapy. Here's everything we treat. And sure, they're going to check the box, circle the phone number and say, call this place and go get yourself some therapy. And I found a lot of people that even come in, I asked them, well, did your doctor explain what we do here, how we do therapy, what the therapy is for? And a lot of them, some will say yes. But most likely, at least the postpartums usually say no. It's kind of like a rushed visit, right? It's not really.
There's so many things to cover. They have such a short time and so many things to cover.
Exactly. So I thought, they're doing their best, so I'm going to do my best.
Absolutely. We're a team.
Let's not rely on them to spend more than they can educating women on all these other things that we have the time and the luxury to, because the nature of physical therapy is a lot more relaxed in a lot of ways, So. Yeah,
good. I think it's a great idea. Excellent. Okay, so now what about the favorite part about pregnancy?
I don't know. I asked my friends this, and I've had some friends with really good pregnancies and some with really difficult pregnancies. And I think the experience when they first feel the baby moving is
so exciting.
And then obviously the first sonogram. I mean, there's the first one for the pregnancy, and then there's the second one for the anatomical one. And the anatomical one, obviously, you could see like a head at that point.
Yes, and the spine. I think seeing that cute little spine. I love those vertebrae.
Yeah, and I think I have a lot of friends that they enjoy that kind of that quiet when it's just them and the baby. And I think that interconnectedness that everybody sees. But nobody else really knows. Yeah, I think I really enjoy that part of it.
I agree. I loved just having my baby close, and it was cool. Okay, and what about birth stories? So what are you hearing about favorite parts of birth stories?
As difficult as birth obviously is, and as demanding as it is, I've had some patients, despite, some tough labors, everybody defaults to, well, at least the baby's okay. At least you have a healthy baby. And, regardless of what may have transpired throughout the labor, which is a little bit damaging and a little bit minimizing for a lot of women who think, well, either they did have a really good birth or they had a really unfortunate, set of circumstances. Yeah. But a lot of them will tell me that they really enjoyed just feeling their body start to, you've done it. So it kind of transitions into this very like primitive, like primal, it just knows what to do. And when that kicks on, I think all the endorphins that rush, like all the hormonal shifts that happen throughout labor, women feel that, especially if it's unmedicated. Not that there's anything wrong with being medicated, but
right.
that's why a lot of women want to do unmedicated, is to feel that. So I think when you've experienced that, some women will describe it as euphoric and almost orgasmic.
Yes, so I was about to say, I've heard about an orgasmic birth. I haven't experienced that myself and never will. But it sounds pretty cool.
Right. So I've actually heard those stories where it was really cool to actually feel my uterus contracting and to know that as painful as a uterine contraction is, even with, like menstrual cramps, it serves a purpose. Yeah. So that's a big thing that I bring up in my birth classes is pain doesn't exist until your brain perceives it. So, you touching something really hot doesn't mean that you're going to get burned until your brain recognizes how hot it is.
Good.
And then it's a threat. So when it becomes a threat, then there's a response that's a little bit more panicked, a little bit more stressful, versus a response that is appropriate to, the input. And if the input is, if you can reframe the pain of a contraction.
I love this.
Reframe what your body is doing, and instead of it being scary and threatening, and it serves a purpose. Every contraction brings you closer to your baby. Every position change, every time the baby drops, every time you feel that pressure, that ring of fire that people talk about when the people and the people rectalis start to stretch, that serves a purpose. That's bringing your baby closer to you, to Earth side. And when they think about it like that, I think there's more willingness to accept that and work through it instead of try to mask it and ignore it.
That's good. So, I mean, that's key, because if you don't have that information going in, then it's going to be terrifying. So you're empowering people with the knowledge and the information about what to expect and then how to respond. So, okay, if this happens, then this is what you can do. Because I'm very much like, okay, let's have a solution. Yeah, right. Exactly.
Yeah, I think if people they hear that they give themselves a higher chance of experiencing all those beautiful things about birth.
Yeah, that's good. And then also the favorite thing about the birth story in general.
So I hear some really like comical ones too, where depending on how the partners responded and depending on I had a patient tell me a really funny story where she knew all of this going in because she wasn't she wasn't in my childbirth class, but she was coming into the clinic as a prenatal patient, and she had pretty much zero symptoms, right? So we hear, oh, you only go to therapy if you have problems, which is not true. But she wanted to learn. She said, I want to really know how I can set myself up so that I don't have all these issues that my friends and my family are telling me about leaking and all this other stuff. So we went through all the birthing positions. I gave her a little bit of an explanation about how labor progresses and the things she can do to comfort and cope with all the pain. And I basically told her, because she had decided to deliver in a hospital. And I think the biggest thing to understand about delivering in a hospital versus at a birthing center or at home, right, is that is an industry where the liability is high. Yeah. And the goal of a hospital is to keep people alive. So sometimes the process of doing that and keeping people safe and alive and, on the right track is at the expense of the patient's comfort, right? Yeah. And this isn't just for pregnancy.
The process, right.
In the hospital, it's not comfortable. And, if you're a fall risk, you're treated like a prisoner. Like, you can't even get out of bed without an alarm going on.
Right.
So I tell people, their job is to keep you safe. And it sometimes might feel like that's not what they're doing. It might feel a little bit different, depending on, your staff at the time. But, that's what it is. They're trying to keep you safe. So the best way to actually avoid a C-section is to labor at home. So to spend as much time as you can during that early and active phase of labor prior to your transition, so that when you go into the hospital, you're in that second stage. And I had a patient tell me that she basically went in after laboring at home for 6 hours. So she thought, okay, my contractions are getting closer together. I'll go now. I think I should go now. And then when she got in and they checked her, she was only 4 centimeters dilated. So it had already been, 6 to 8 hours, and how much longer? And her nurse told her, well, you probably still have a couple times. It's your first pregnancy, so you could probably shower, you could eat a little bit, rest, keep doing what you're doing, keep moving, right? And so she said she got in the shower and she hid. She stayed in the shower for she said it must have been an hour, because by the time she got out, she was pretty much 9 to 10 centimeters. But she said, you know what? being alone and the warm water, and I just kind of breathed. I felt everything. I just kind of had time to sit with myself. And she said, that was really nice. And then by the time I was done, I was so relaxed. She's like, I think I was so relaxed that when I just started pushing, like that's why her cervix dilated so fast, is probably because she was so relaxed. And then her pelvis to push because there was quiet, right? She could focus. Yeah. So I hear those stories where, I just really like being alone in the shower, or, that right before that transition. It's always before the transition.
Yes.
That piece, that, oh, I'm really connected with myself and I'm going to do this. It's happening. So
yes,
that's a lot of positive stories about that part of it.
That's good. I like that. So how can we improve prenatal, childbirth, and postpartum education? So this is right up your alley.
Yeah, I have my opinions on that, obviously, which is who I put in.
Hey, I'm interviewing you. So you get to, this is your platform. So, let us have it.
I definitely think that it starts prenatally. I think we need to stop waiting. I think that, this is just Western medicine in general. It's very reactive. Very little of it is proactive, and very little of it is prophylactic or preventative. Mm-hmm. So when it comes to prenatal and postpartum care, that starts, honestly, I'm going to go, this is pretty extreme, but I'm going to go back to sex education. So if you're going to talk about intercourse, and if you're going to talk about preventing pregnancy, or, just general sexual health, it starts there. And it starts with people becoming sexually active, because no matter how careful you are, and no matter how, active or inactive you are, infrequent, pregnancy is a possibility. So if we're not educated,
that's how it happens.
Right. And then from there, once people understand, oh, this is how you get pregnant, what happens when you're pregnant, right? And then once you're pregnant, what happens after the baby's born? And how does that process even happen? So I think it really starts there. And I think that starts with having those open discussions with the younger generation who are becoming sexually active. But when it comes to pregnancy, so say you're already pregnant, I think it definitely comes down to putting the autonomy in the patient. So empowering versus, I feel like there's a spectrum of providers where they either kind of coddle them and they say, I'm going to do everything for you. And you're going to go to chiropractic care. You're going to go to PT. You're going to do all the things. I'm going to take such good care of you. And then what happens? They're not at the hospital when they deliver. So there's like that end of the spectrum. And then there's the other end of the spectrum where it's kind of like, oh, well, you're pregnant, so just deal with it. Yeah, that's just par for the course.
You have leakage?
Yeah.
It'll get better once you have the baby.
Exactly. Even some therapists that maybe don't have the pelvic health training. Oh, well, you're pregnant. Of course your back hurts. Okay, well, even though physiologically that makes sense, I don't think that's the right approach. So I think it really starts with educating, again, throughout pregnancy. This is what your body's doing. This is the purpose. If we always go back to the purpose, which is to bring forth a new life into this world, I think all the scary things are going to be a little bit, they're still going to be intimidating.
It frames it. It's perspective.
And I think it starts with that. And I think as long as we empower women to say, you are going through a lot, here are your options, here are your choices. And then you can decide, okay, maybe I want to do some chiropractic. Maybe I want to do some prenatal yoga. Versus, oh, just wait till the baby's born. Because that's definitely
grin and bear it.
It goes away once the baby's born. And it doesn't all the time.
Right, exactly.
Right? And on top of that, like we said, just because the baby's born, sure, your body might start to, feel a little bit more like yours again. But you also have a baby attached to your hip. So how are you going to go take care of yourself then? What's the difference between then and now? So I think setting up that expectation, I think it goes back to setting up expectations.
And going into postpartum, because how much time and energy do you have to learn anything postpartum? No. So going into postpartum, understanding how to do these things and what is the goal, and okay, this is the best way to carry my baby or lift my baby or stand or sit or breastfeed, or when should I start activating my pelvic floor, and all of these things, understanding before.
And I think they should practically say, they were like, well, I want to go back to therapy after, and I want to participate, and I know I should. And then I do, and it got better, but I wish somebody would have told me sooner, right? That's like the whole thing. I wish somebody would have told me sooner. And I asked them when I was developing my course, I asked, well, what's so fun? I feel like nobody wants to kind of rain on your parade with everything negative that can go wrong after pregnancy during the healing process. So if you're saying, what I'm hearing is you want people to warn you about these things, is there a way to do that without scaring people more? or intimidating people more. Like what's
right,
overwhelming, right?
right? Because we don't want to panic or scare
exactly.
people.
And so a lot of them will say, you know, I think it just comes down to obviously delivery. You can't just say, oh, this happened to me, it's going to happen to you, right? Actually, a lot of birth workers and a lot of, I think, pelvic PTs go into pelvic health thinking, you know, I had a really bad experience, so I want to save everybody. And I want to prevent this for everybody, which is a very noble cause, but it's just not doable. That's not necessarily possible. But instead of that being the goal, it's more so here's the possibilities of what can happen. Here are the common things that occur. And here's, like you said, what can I do? So what are my options if that's me? If I find myself in the shower and, you know, I'm washing and I feel, you know, the balloon.
A vaginal balloon.
You know, so, and that's very common with nursing, very early on postpartum, especially with prolonged second stage labors. And, you know, just knowing, oh, I had a patient go to the ER for that.
Yeah, because we've never heard of it.
Yeah.
Like, what is happening to me?
Right. And then, then the alternative is, okay, go on Google and search for, you know, prolapse. And then what do you see? All these.
It's terrifying. My organs are falling out. Yeah. So what am I going to
do? So when I asked them about that, they said, I just wish there was, you know, this is what you would feel if you had it. And here's when you should be concerned if it's a problem. And then here's what can help. That's the part that's helping is here's what will help. Here's who you should ask. Here's who you should call. Not just, here's what can go wrong. Sorry, you had a baby. Yep. That's your life now, you know? So.
Exactly. Excellent. I love it. Very good. Okay. So what's one piece of advice you would give to expecting parents?
I think a lot of my parents have said that they would advise somebody to go to therapy while pregnant. And almost all of them say, I will go when I'm pregnant, even for their second and third, you know, other pregnancies, because of all the stuff that they learned and how much they learned that could have helped if they had done it throughout the pregnancy instead of waiting till after. So I obviously big plug for therapy as a therapist, but also, just, you know, I think getting off the internet is something a lot of people wish they had done. Not for this, you know, because you want to be prepared, but again, knowing how, or having somebody like a therapist or a doula, having somebody help you navigate all that information versus trying to read all the books, watch all the birth videos, take all the classes, you know, kind of over prepare yourself and kind of psych yourself out because a lot of information conflicts, right? There's a lot of different, I guess, philosophies about how to process childbirth. Right. And so, you know, finding the best fit for you. Because I've asked people who, you know, who have taken childbirth classes, oh, which one did you take? What did you like about it? What was lacking? And a lot of people, you know, a popular one is the Bradley method. So the Bradley method is a huge one. Lamaze is another, that's like one of the, those are the two staples. Yeah. When I was doing some field work, just, you know, what's in the curriculum? Like, what do they talk about? There was an article from like the 70s and it was talking about how Lamaze and Bradley were like, they hated each other. First of all, my goodness. OBGYNs, I believe, that developed these courses. Because on one end, Bradley is completely unmedicated. You don't need medication. You can do it all on your own. It's the husband coach birth, which they evolved to now the partner coach birth because obvious reasons. And then on the other hand, you have Lamaze, which is breathing, relaxation, also unmedicated, but very much revolving around masking the pain, not necessarily moving through the pain. So you either have some, you know, a philosophy of like, okay, breathe and you won't feel any pain because, you know, you'll be pretty much distracted from it versus, oh, that didn't work for me, but Bradley method said I didn't need, you know, I could do it unmedicated. And so I want to do it unmedicated. And, you know, things don't always fall into place perfectly. So understand, you know, the adaptability that you mentioned, like, oh, maybe I don't want an epidural, but if it gets to that point, I'm open to it. You know, let me know. Right. Yeah, so I think a lot of women wish that they would have looked at multiple options instead of subscribing to one and, you know, feeling super prepared for your natural unmedicated birth.
Yeah, this is your expectation. And then it doesn't go according, and then you're blown. Like
getting the opposite. So I actually had a patient who took the Bradley method and she told me she did it she had a vaginal birth, completely unmedicated. And she was like, I felt fully prepared and educated and empowered to go into my vaginal natural birth. And I got it, except for the fact that her amniotic, her water bag, it didn't break and it had a very, very, very minor tear in it to the point where she didn't even feel a drip. So for 2 days, so for almost 48 hours, she had a drip in her amniotic fluid. And then there ended up being meconium in the fluid. So she ended up having to get induced with Pitocin, which automatically heightens your contractions, right?
Yeah.
So you have artificially produced contractions that are not, you know, in the pattern that is predictable or at least manageable, you know, without more medication.
Right.
And she said, I really wish I would have just gotten the epidural because I had Pitocin. So it made it completely different compared to what I was expecting because I had an unmedicated birth, but I had to be induced. And at the end of it, she even said, I think my doctor should have just done a C-section because it took so long. You know, so there are those situations where she didn't know her bag, you know, ruptured. I don't want to say ruptured because it didn't really break, but there was like a little rip.
Yeah.
So, you know, she didn't know any of that. And now she's here thinking like, I'm going to do what I learned in my class. Yeah. And this is nothing against Bradley method. It's just
just expecting the unexpected.
Yeah. She actually accomplished what she wanted to do.
She did.
Class,
she
but
did.
In her mind, she thought, well, if I had the Pitocin, I wish I would have known, you know, here are my options. This is what you might
or this is what to expect. Yes.
Yeah. So again, just setting up the expectations of regardless of what you want and what your heart's desire is, you deserve that and more. But if you don't get it, what can you do?
Yes. So. Good. Okay. So we have a few sticker questions that we're going to, are you doing okay on time?
Yes.
Okay. So what are some of the best exercises during pregnancy to prepare for birth number 2? So while I want you to answer, but I want to do something that I haven't tried before, if you don't mind.
Sure.
Like I have this little button here that I can push, I think, that will pop up the sticker question.
Oh.
So that's what I'm going to try. So you talk and I'm going to try to press the button and we'll see what happens.
Great.
Okay.
So best exercises for second pregnancy is what you said.
Never mind.
This is for second pregnancy.
To prepare for birth number 2.
Okay.
Okay. That didn't, what I thought didn't work. So just talk.
So, you know, I don't know if it's specific to second pregnancy, but that depends heavily on how the first birth went, obviously, depending on what changes were sustained with that.
And I have no idea.
Right. And I think 100% one of the best exercises you can do is learn how to coordinate your breathing. So if you can learn breathing patterns and not just one, right? So I think there's like in the yogi world, it's the belly breathing, the diaphragmatic breathing, and then, you know, for high level impact exercising and weightlifting, there's like the breath holding. And it's not to say that one is better than the other, but you got to know how to do both. And I tell this when I prepare patients for pushing, because that's obviously a huge physical component of childbirth, is there are multiple ways to push, but it all starts with understanding how the pelvic floor and the diaphragm and the trunk connect. So if you can master that, then you can explore all the breathing patterns. And depending on if you're early second stage labor, when you just transition and you have all this energy, versus late second stage labor when you've been pushing for an hour and you're exhausted, maybe you're going to need a breath hold technique to increase that. But pressure. You can't teach that to anybody if they don't understand pelvic floor and if they don't understand diaphragm. So I think connecting those two are the best things you could do for childbirth and postpartum, because once the baby's delivered or birthed, those things have to still work together, but with different input, because there's not any more pressure there. So I think for sure that connection.
So what would you tell somebody that has never heard of that connection, a new person coming in?
So I think a lot of it has to do with visually seeing where these body parts are, so the diaphragm and the pelvic floor. And I usually explain it as, you know, there's that whole, I think it's Diane Lee's, the canister, right?
Yes.
Canister. So I'll explain that to somebody and I'll say, you know, the pelvic floor is the bottom and then the diaphragm is the top, and the cylinder, around the wall is your abdominal muscles and your spine. So the way that all of those have to work together is, they manage pressure. So depending on where the pressure is directed, you're going to have some tissues that have to support that. So for bowel and bladder control, if the pressure comes down, either the muscles relax to let it out or they squeeze to keep it in. For the abdomen, they have to generate pressure to maintain that so that the belly doesn't bulge, depending on what the goal is. And if there's any compromise, the pressure is going to go somewhere. Yeah. So I'll always explain, sure, you hear a lot about bladder prolapse, urinary leakage with pelvic floor weakness, but you don't hear a lot about, you hear a lot about it, but you don't see it connected in a way. A bulging disc in your spine is another symptom of a mismanagement of pressure, or even movement if there's not, a traumatic movement that caused that, but maybe repetitive pressure being placed on the disc with that, or acid reflux, repetitive pressure and
coming up.
Right. And a weakness in your esophageal sphincter causing that weakness to go up. So I tell people, you know, it's going to go somewhere. And if your goal is a specific direction, whether that's to pass a bowel movement or to
have a baby,
child,
yes,
or to, you know, pass gas. How many people can't pass gas properly, right? They push and nothing comes out and they get all uncomfortable. So, you know, depending on what your functional goal is, you have to call on the movement pattern that fits that function. So with childbirth, it's all of those. So,
yeah, no, that's good. Good. I like it. Okay, we're going to try to squeeze in a few more questions here.
Sure.
Okay, a leakage after a miscarriage. So,
yeah.
Any tips?
Well, so miscarriage is always tough because that's obviously something nobody wants or expects.
No.
And it's tough depending on how far along the pregnancy was when the miscarriage occurred. So if it was more towards the early stages, you know, more than double or early single digit weeks, I guess we should say, or early double digit weeks, then it might have been spontaneous. So I think depending on how much cramping or pain there was with that, it's addressing that component of it to make sure that the pelvic floor muscle tone stays healthy and not, you know, guarded. Right? I think there's a tendency,
like overactive. Mm-hmm.
Right. So if it was a painful miscarriage, right? Because sometimes it's, you know, you didn't even know what happened. But if it's painful and there's a lot of cramping, then that might be a good first step, is to make sure the resting tone of the muscles is healthy. And then if it was later in the pregnancy, sometimes you need to get a DNC, which is a dilation and curettage.
Yeah.
And
that's traumatic to the tissue.
Right. And that goes through the cervix, which can be also very painful. And then, you know, the bleeding after that and the cramping after that. Again, a lot of it is physical pain, not even touching on the emotional side of it, but at least physically that response to pain and that persistent threat of what is my body doing. I think really understanding that connection between your nervous system and your your musculoskeletal system is huge. So I don't know if there's a specific exercise for that I would give. I think it goes back to just talking to somebody and getting educated on what are the strategies that you can manage your nervous system output and input when it's tough. But I think that's the biggest thing.
That's good. And potentially even being assessed by a therapist, like checking out your pelvic floor. Do you have trigger points? You know, are there physical things that are occurring too? Mm-hmm. So specific labor positions that are better or worse for the pelvic floor. What do you recommend?
So obviously I think side lying has been the most recently studied to show less strain on the pelvic floor muscles. But I think it depends on the context of your labor. So if you are medicated versus unmedicated, if you have an IV line and if you don't have an IV line, or if you have to be monitored for whatever.
So many factors.
Right, because then you have all these things attached to you. So, you know, depending on the context, you might not be able to do all the positions, but definitely I tell everybody the best position is the one that you're comfortable in.
Yeah.
So if you can be comfortable, then you're not fighting gravity, you're not fighting your contractions. Your body can do what it needs to do without being so focused on trying to manage the threat of like, oh, I'm not comfortable here, I'm cramping here,
mm-hmm.
or, you know, there's too many pillows, or this hurts my back, right?
Yeah.
So if I had to choose the best position, I think side lying and gravity assisted are obviously better for labor.
So that would be kind of squatting over a ball.
Squatting over a ball, hands and knees is really good. Sometimes even sitting reverse on a toilet.
Okay.
So you're facing the back of the house, you could rest on top of the toilet, and you have the obviously the toilet seat cutout where the gravity can kind of help with that. But also for pushing, you know, there's a debate of, you know, a lot of women don't want to push on their back anymore because has been shown to be pretty, I mean, not necessarily negative, but not necessarily positive either.
Yeah. Higher risk of tailbone injury.
Right. And especially depending on the baby's position, if they're sunny side up or, you know, turned to the side. But I think the one thing that's important to note is that no matter what position you choose, when you get to pushing, it depends, again, how long were you in active labor for? Because if you're exhausted from squatting to manage contractions and to help get the baby down, or if you're, you know, rocking,
right.
walking,
yeah,
your legs might just be tired. So, you know, you don't want to be so rigid in thinking that I need to deliver in a gravity-assisted position for my pelvic floor. If the alternative is that, well, I'm holding this position in a deep squat, or I'm on my hands and knees, but I'm so tense because I'm so tired and I want to fall asleep, and I have to push for another hour.
Yeah.
You know? So
how am I going to do this?
Go with whatever's comfortable, but practice. I always say practice all of them. Have your peanut ball, have your pillows.
Good.
See what's comfortable for you. Not everybody can get in a deep squat, right? You know, that is orthopedic therapists.
Yeah.
So, you know, I think just having the practice and see how uncomfortable versus comfortable it is, and let them know it'll change, right? This might feel really good for 1 minute, and then the next minute you're going to hit it, right? So I think there's no one best position, but understanding the process, again, of labor and the fatigue factor and knowing your own body because you practiced those positions before, right? So
good. Practice. Okay, so major pelvic floor damage after the first pregnancy. When is it safe for the second pregnancy?
When is what safe?
Probably to get pregnant again. Like, I think she's asking how close can the pregnancies be?
Right. So,
I mean, they can be very close, but go ahead, please.
So, I definitely think tissue healing is predictable, right? There's a way that happens in the body on a cellular level. So that's the first thing, is make sure you healed within that timeline, which is full. I mean, obviously the proliferative and the regenerative and all of that phase, all of those phases takes up to years. But I think it depends on what you're doing in those very crucial weeks. So if you were doing a lot of scar tissue, you know, massage, and having a therapist work with you on getting the flexibility back in those muscles after they fully healed, and practicing managing pressures, contracting versus relaxing, I think you could go as early as a year in between, because the remodeling phase of a tissue, you know, even think of like an ACL tear, after you get past those first 3 months, it's pretty much, you got to load the tissue to make it stronger. So if you did all of that, and follow those steps,
it's ready to be loaded.
Right. So technically, the pregnancy doesn't start loading the tissue till later on. So I would even say to start even trying to conceive, you're safe as long as the process of conception, right, intercourse, is pain-free. So depending on, again, what you were doing in those I would say the first 3 months, right after that traumatic birth.
Okay.
What kind of things were you doing? And if those things set you up for success so that you were having pain-free intercourse, I think it's pretty much as long as you give yourself at least, 3 to 6 months to start returning to intercourse, because everybody says 6 weeks, right? But that's really it's not a magic wand that you wave at 6 weeks.
No, not a magic wand.
But, you know, I would say that the goal for a lot of people is to at least by 2 to 3 months start having pain-free intercourse.
Yeah, for sure.
And if that's the case, and you happen to get pregnant then, the first try, right? Who knows?
Woo!
You still have 9 or 10 months to go. So you still have time. You still have some cushion. So it's not like you have to wait to even start thinking about pregnancy. It's that you have to start really early on getting those tissues to heal and doing the things that encourage and promote healing that will set you up for early pregnancy.
Success, yeah. Mm-hmm. And your symptoms. So are you having leakage? Are you having prolapse? You know, with pain? Yeah. Good. Okay, last question.
Sure.
So do you have any specific strategies for a vaginal delivery with a stage 2 cystocele and rectocele? So pelvic organ prolapse, do we have specific strategies? Right.
So with a grade 2, I would say that, you know, pretty much everything that you would tell anybody without a prolapse is still fair game. The thing you want to really be careful with, I think, is the pushing. So depending on, again, how long you labor for, how tired you are, gravity-assisted positions may be helpful. But I would be careful how long you're in those positions. Yeah, I don't think there's any evidence that studied that specifically.
Not that I know of. Right.
But in general, you want to really minimize your risk of needing extraction assistance. So forceps and vacuum. I thought forceps were so outdated. And I said, who's still using this? And then I had one, client in my birth class say, actually, my friend just delivered last month and she had some forceps.
Yeah.
So, I mean, obviously, depending on the location. But
yeah. And they're not, they're not the first line of choice for everyone, right? Like, if there's an issue. So
right. If there's a rush. So
yeah.
I think with a prolapse, the main physical things you want to think about are managing pressures. So pushing properly so that you're not spending a ton of time pushing against a tense pelvic floor. emptying your bladder and bowels before or throughout
Good.
labor, right? I mean, there's a whole thing of I don't want to poop during my labor, but it's, you know, it happens. But if you're aware of how to have bowel movements properly without straining, right, and that's pregnant or not with a rectocele or cystocele,
Yes.
keeping that as empty as possible throughout pregnancy, which emptying also helps stimulate pushing, so or descent, so it helps
And
progress
opening.
more nicely. So I think doing those kind of things to manage bowel and bladder throughout pregnancy and labor are good, and then using the gravity assisted positions a little bit more judiciously, and maybe doing it with support, right? So maybe you're in a squat, but maybe you're sitting on a ball.
I like it.
Right.
I like it a lot.
Instead of just in a deep squat where gravity is just taking everything with
Yeah,
it.
and you have nothing counteracting the force. That's beautiful. Well, do you have any parting words that you would like? Maybe give a shout out again for your clinic for those that may not have been here at the beginning.
Right. So I'm in Los Angeles County. I'm in Southern California. Our clinic is called Women's Advantage Men's Optimal Health, and it is located in South Bay in Torrance, California. So come visit us. We treat everything. We take, we're in network with a couple of PPOs and HMOs, and we take Medicare. And we always are verifying out-of-network benefits as well. And then as for my childbirth classes and my other stuff, I have a website, drqgpt.com, and that has all my information on there. And I think the last parting thing that I would say, I know we focus on the prenatal education and the childbirth and all of that, but I just really want to say that anybody who's interested in pelvic health, because this has been a thing too, I think, with social media, is that if this is something that is calling you, I think just ask somebody some questions. You know, don't be afraid to reach out to either a therapist or a labor nurse. You know, if this is something that has intrigued you, we always need more help. We always need more.
Absolutely. There are not enough of us to reach all the people in the world.
Yeah.
There's still countries that don't have pelvic therapists, much less cities. So,
Yeah. So,
good. Well, thank you so much. Thank you for your time and
thanks for
expertise.
having
I'm
me.
so excited about your course.
Yeah.
I would like to purchase it when you begin selling it.
Yeah.
So hurry up and do that.
I know. I'm working on that manual too, because people
I
have that
know.
available for download.
Yeah.
So
It looks really good. It looks really good.
I'll work on
Excellent.
that.
All right.
you.
Thank you
Have
so
a
much.
good
Thanks
weekend.
everybody for joining us. Take care.